Hello and welcome. Today we'll be talking about briefly how to give effective virtual scientific presentation or effective scientific presentation. And I've highlighted these points about effective, virtual, and scientific. I'll focus them in order of scientific and then effective and then virtual and use some of my Toastmasters training for last 10 and 11 years. This you can apply for your interviews as well. This you can apply for your actual presentation live when we'll be doing it. So next 15-20 minutes, I will cover some of these three topics as in this order: scientific, effective, and virtual piece of it. Imagine when you submit your abstract. Imagine when you submit your paper, and then you're going through the emotions of a relief that, oh my gosh, I really worked hard, and now I've submitted this particular thing, which I really want to be, presenting it as well. As soon as you get acceptance email or invite from the journal, you a little bit anxious, even though you've given a presentation before, or maybe this is your first time to give the presentation. My hope is that you can turn that anxiety into a learning curve. That anxiety could be a learning opportunity for you, regardless how big the audience is, regardless how big the stage is or how small the stage is. This is an excellent opportunity for the growth. I have given talks when there are hundreds of people on in the room. I'm on a podium, or there are only three people sitting in the whole room. If you have gone to any national meeting, sometimes these breakout sessions are not completely full. It doesn't matter. As far as one person sitting, and then you can teach them something, or you can share your work enthusiastically. That is a great opportunity for you to learn from it as well. So let's focus on scientific part. By now, you already know that having a title is absolutely essential for whatever talk you're giving it. I don't think so. None of us are so big enough that we can just start talking without a title. That should not be the role. So I'm giving an example from my first author paper from Critical Care Fellow in 2014 when I was the first senior author on this paper. Increased fluid administration in the first 3 hours of sepsis resuscitation is associated with reduced mortality, a retrospective cohort study. This is just an example of an abstract, and then I'll share how in 80-90% capacity you can turn that into a presentation which is more effective, and then what things could be done as well. Of course, your author list affiliation, background, your method part of it, and in background, and then you can include some of those areas too. You will pay attention that not only for an abstract, for a paper, for a presentation, the title is very informative. I'm talking about PICO. I'm talking about sepsis population, exposure, outcome, mortality, and what type of study is. So follow that pattern. Sometimes the title is long. You can go for a very shorter title or some cheeky title as well. You can stay as an old school style where you're giving an informative title for that matter. Then your result section with number of total patients and exposure in group and outcome group, exposure group and control group, and what was the outcome, p values, and things like that as well. You can always include demographic and then a number of patients, and then you're concluding it and concluding what, as you are tying it back with your title. That is very important, that you're always tying it back with your title or main aim and things like that. Now let's say take this abstract, which should be in a Word document and things like that, and turn into a presentation. So if I take this abstract, put down my first title there, it's a lengthy title. You can cut it down. One thing you can add is maybe a figure or diagram. Add your name, your co-author's name. Any presentation when you're doing it, if you're just doing your graduation presentation, you are expected to write just your name. But when you're presenting a paper, an abstract, please give credit to your co-authors, give credit to your mentors, and things like that as well. So that should be your first slide. Second slide is your background slide. And we expect you to talk about your main project during your graduation. If you are a GRSP scholar, you write down few bullet points. You write down some references. You write down a figure or image if there's a pathophysiology around it as well. Few bullet points, 3 to 5, and then talk them through. Bullet point should not have a period in the end. These are your guiding principles. You can make some notes around it. Don't make it too crowded. Don't make it too small font size. 3 to 5 sentences, bullet points, have an image, figure, or whatever it is as well. You can have maybe one or two background slides if you feel like sharing more information with people. Maybe you have a slide on hypothesis or primary aim, and then write down those things in a next slide for that matter. Put a figure and image around it. I'm a huge fan. If you want your slides to be interesting, put a a figure, put an image on every other slide, if not possible on every slide for that matter. Keep it high font so people can read it. Put the logos of your institution or GRSP for that matter. Put those things in the left or right upper corner, things like that, and put reference in the bottom. You can put a small font references in the bottom, create a new box, and then do that as well. Then go into your study design phase. Talk about your first sentence should be what type of the study is. It's a cross-sectional survey-based study. It's a systematic review meta-analysis. It's a review article. It's a social media hashtag-based study. Whatever study type is, that should be your first sentence. Then include your inclusion exclusion criteria or data collection, data types, whatever is applicable to your research point, you should include. I'm including my inclusion exclusion criteria for the project we presented for that matter. Again, see, using the bullet points, sub bullet points, and there's a mistake. There is, after trained reviewer, there is a bullet point there that should not be there. So use your style, use your figures, use your images, use your tables, make it interesting, make it less crowded, bigger fonts, interesting. Use the word, the space wisely. You don't have to leave too much empty space for that matter. Put down your references and citations. Add to your method that what was the data collection, how we collected data, what the different variables we used it, and things like that. Talk about your flow sheet diagram. Don't do a mistake of like what I'm doing it right here. This diagram is a little fuzzy. So the key is that make sure that you have a bigger screenshot taken, and then you can drag it down from corner to make it smaller rather than trying to take a small picture and then try to drag it higher. You don't need to leave a space empty. So if you have a couple of figures, then use them appropriately. Why you want to use a small figure and leave everything empty? Make a bigger figure and then and keep it there for that matter in this sense. Then talk about your results. Some theoretical result, you talk about how many patients, what was the age, and so on and so forth. And your tables, you can talk them through. I pick up these things from the journal article. That's why it's coming a little fuzzy. You should have your own thing from Word documents or PowerPoints. Put them in here as well. Have your baseline table if you have something from patient data related things. Have your second table if you're talking about it. Take screenshots, bigger, clear screenshots, put them into your and talk them through for that matter. And then final results, what you have, in univariate analysis, this I figured what was the comparison group and so on and so forth. And then have a second slide on result, because if you have more than one result as well, you will see how I'm using more results than methods and all. I have like one slide of method, 1, 2, 3, 4, 5 slides of results. You can go heavy on your method if you have not very many results to show. You can have 4 slides of methods and maybe 2 slides of results. And in a sense, you don't have to have. You can finish things in 1 slide of method and 1 in result based on how much space and time you have and how much you want to speak up. If you have more results, have more slides on result. If you have more method, have results on more method. And then ultimately conclusion. After the results, what's the odds ratio after adjusting for confounder, and then you say after adjusting for these things, underline them. See, I'm not using a different color. I'm using a bigger font size to show to the work that that should be clean to you as well. And then conclude it, and in the end, leave a thank you slide. This is my hashtag analysis. This is my my hashtag, or this is my hashtag or my handle, my email ID. Any questions and things like that as well. That should always be your last slide in that fashion. So far what I've covered is turning into an effective scientific presentation. So scientific part of it, covering the chronology of title, introduction, method, result, conclusion, and thank you. That is a baseline for all of you guys, that don't miss out it. You can add things if it is applicable, and sometimes things are not applicable. I don't think so. If any research presentation, you will not have an applicable conclusion or result or method or introduction for that matter. Now, using the principles to make an effective delivery of that presentation. Though some of my Toastmaster lessons are here. Practice. We spend more than 95% time in preparing slide. We spend less than 5%. Just sit down in front of a computer and then turn on your Zoom or record it and then just go from start to finish what you'll talk about. Pay attention to your transitions. When you're doing transitions, are you using the title? Repeating the title, that is the most boring way of using transition. You should know what next slide is coming up. You can turn on your slideshow at your end, and then what I'm doing it, I can see my next slide already, or whatever different method. If you have more than 2 monitors, you can put them in that way, or once you go through, you know what is the next slide. So bring that connecting sentence as you ending the last slide as you go to the next slide as well. Don't repeat the title of the slide. So Toastmasters lesson, Practice, relax. No, you're not reading the slide. Don't do that. So practice. That's why it gives you more ease of on your content. Relax. We get too agitated, too nervous. I still get nervous when I give presentation. It's okay to have enough butterflies in your tummy, but not too much that you get overwhelmed and you start sweating in there. Just relax. Be on time before a few minutes. Drink your water. Keep your anything close by, and then enjoy the presentation piece of it. Try to use a vocal variety where you have to emphasize on the point. Go high, and when you have to have empathy, go low. Let people sink in what you're talking about. Some people who like me who speak faster, you should plan to slow down all the time. Nobody likes to have faster people. Many times in national presentation, they're older people. So you want to slow even further down to make sure that your presentation is liked as well. Pay attention to filler words, verbal static, ums, ahs, so's, and. I used to do it a lot. Take a pause. Your brain think faster than what your mouth can speak. That's where the verbal static come in. Ums and ahs and so's and ands. These are the killer for any good presentation. You cannot hone them in one day, but once you practice and pay attention to things, content is developed first, then flow and delivery is developed second, and then you focus on vocal variety and filler words in that order. Your content is not ready, and you are doing excellent work in filler words. Who cares? So master your content, worry about your delivery, and then vocal variety and filler words come in that order. Take a pause, like what I'm doing right now. It's painful for me, but for you guys, it's just 1 second of a pause. Okay. Your opening is most important. You draw attention. You are excited about your project. Until you make everybody excited about your project, that is not an effective talk. So have an opening, maybe a quote from somebody, maybe a very high statistics from something which you can draw attention. A million patients died every year in America with sepsis, or XYZ, COVID-19, 10 million people have died. Whatever stats you can give it, or whatever topic you're working on, have a grand opening, 1 or 2 sentences, you draw attention of people. Tell them what you're going to talk. Like I told you that I'm going to talk about these things, and I'm talking about those things, and then summarize them what you just talked about it. So basically, you're doing these things 3 times. You're spending 2% of your time telling them what I'll be talking, spending 95% of time talking about it, and spend another 2-3% just summarizing what you just talked about it. That's a very effective strategy. And having a strong ending. Give them call for action. Join me in this one, or this is something we want to do it, and this is the result, and then look for my results when they get published. Whatever ending you have, make it plan, have a very strong ending in the end as you're talking about. Last but not least, it doesn't require talent to start on time. So start on time, you know your 10 minutes, and end on time. Be aware that usually you can talk 1 slide per minute, plus minus your first and last slide. So 10 minutes has been given to you. You should not have more than 12 slides if you're including it, title and then thank you slide. So you can only talk 10 slides in effective in 10 minutes without rushing too much or talking too much in as well. That's a pretty good rule of thumb as well. If you have a talk to give for 15 minutes, I would suggest to have 15 to 17 slides. 30 minutes, 28 slides. 1 hour, no more than 45 to 50 slides, because sometimes you end up talking more on one slide than others as well. That's a rough rule. Always your number of slides should be lower than the minute you are allowed to talk. Shorter time, you can actually rush through quite a bit because your adrenaline is high. Otherwise, do that. And we get nervous and anxious and we forget to smile. Smile when you're presenting it. This is your work. Take a pride into it. Bring the enthusiasm and more as well. People are sitting there, they're cheering you to be. Nobody's paying, oh, I want her to fail, I want him to fail, I wish she or he does some mistake, and I'll happy be about it. No audience is wishing for that. All audience are wishing, they are cheering, they're looking for it. You do something well, they clap in the hand in between, they're like, what amazing presentation, in person or on Zoom as well. So audience are at your side, they want you to succeed. Thinking that in mind, you prepared for it, smile, enjoy. This is your time to shine. Okay. So what we talked so far is the scientific part, the effective part using Toastmasters lessons, Third thing I want to talk about is virtual part. And see how I transition without going to transition. I've given this talk, so I know that next slide is coming for virtual. So without reading, I am giving you this smooth transition, and that you should be doing it as well. This comes from reading, I think, Forbes magazine or some other places a few years ago as well, how you can ace your virtual presentation. And this applies to your interview skills as well. And these are some of the things we've been recording in different videos. So you might find them some similar presentation as well. Lighting, laptop surrounding and background. Try to see if you can face on natural lighting. For that, you have to facing the window, turn it on and things like that. And if that's not possible, have a night lamp facing you. If you're expensive, have access to money, get those ring lights and things like that. Otherwise, I'm keeping my table lamp right behind my laptop, so the light is coming on my face, so my face is equally lit, not one side is not lit. If I turn it off, you would see that my this side is better lit because my light is coming from this window, and this side is a little bit darker. So pay attention to these things, that when you're doing it presentation, that you're equally lit for that matter. Laptop should not be on wobbly surface, not on your lap. Actually put them into a table or stack up books, and making sure that they are big enough to hold it as well. Do not look down. You don't want to have a laptop so low that you're literally looking down and talking to the program director or talking to the audience for that matter. It should be kind of in similar lines, so you are looking into at the same level. You should be in center, like most of you are in center as well. It should not be that you're just looking your head and then you're talking the whole thing that way, or they're looking down and somewhere else for that matter, or you're not in the one side and then just everything is empty on this side. Just pay attention to these aesthetic things, and which are common sense, but sometimes you may not see that common sense being followed. Surrounding standpoint, silencing your phone. My phone is always silent. You never hear it go live for any phone calls or anything like that. Use a quiet space. Put a printout, a Word document, or just a paper and write it, meeting in progress, presentation in progress, interviews in progress, and paste it outside your room so nobody else come in when you're doing it as well. Let your roommates know, let your parents know, let your spouse know, and kids, I don't know, give them iPads or laptop, or make them sit in front of computer, and then in front of TV, if that's what you have to do it. Turn off your notification from your computer. If you're using Teams and other things as well, just turn it off, or emails. Otherwise they'll keep popping and they might be get shared when you're doing the presentation. Having a professional background is always a good idea. Let's say Rupali is using that, and or Mariam is doing a what you call it as a blur the background. I'm using a virtual one. Sometimes people suggest that if you don't have a good quality, don't use a virtual background, because it kind of doesn't take away the hand gestures and things like that, or you look like a head bobbing or flying head as well. Otherwise, if you can do something like that, use a plain virtual background, not like flying and then beach and all those things, or use like Mariam, or use like Rupali, which is pretty neutral, maybe bookshelf, things like that. Make sure there's no clothes hanging in a treadmill in the background and things like that. So just keep a curtain, books, or just like Mariam is doing it as a you can blur it out. Those are pretty good background. Like Emma's background is pretty neat as well. Sharanya is good too, but she's the window is in the back, so her face may not be visible properly. So that is not advisable. I already talked about the removing unwanted items, because they can say a lot about you without saying any single word. So make sure that you're very cognizant of unwanted item in the background. I never thought I'll talk about makeup in my life, but here I'm talking about it. Those who use them, there is no harm in using a lighter makeup. Uh, I did not know it until what the difference between powder and concealer. But if you know what these things are, that's not a bad idea either. To use it, I've seen men using it, or especially translucent powder, because sometimes you sweat a lot and it's a hot environment, and kind of take away that shiny thing. Using a translucent powder is not a bad idea. Zoom Pro might have a touch-up button as well. You can use it as well. I have not done any of these things. This is the way it is. But if I start seeing reflection, things like that, there's no harm in doing some of these things which I mentioned here as well. I do not have any in conflict of interest in any of these products. It's just something which can help you out to stand out a little bit as well. If you have not noticed so far, and I strongly advise you to do that as well, we tend to look at ourselves when we talk. So pay attention to the camera when you're talking, because that's where you are talking to people. Pay attention. You can put the speaker on the top of corner and keep looking at the speaker and the camera. That's where you are making an eye contact. Otherwise, don't look down and talking to it, and don't keep looking up at the roof or floor, ceiling. That is not a good strategy. Make an eye contact. Look at yourself. Look at the person you're talking to in an interview. But try to look at the camera when you're presenting it. Look, keep an eye on the topic, then look back at the camera as well. You don't have to do it every single second. It looks very odd and artificial. Just get the point what I'm trying to say. Uh, Smile. I can't emphasize enough. If you're not smiling, you're not giving positive vibes. People will be feeling the same way as well. Just remember to smile. You don't have to stop and smile in between. That'll be creepy. Just keep smiling, keep showing what you're excited about your work, and that's good enough. Maintain a good posture. I can't say it enough. Leaning forward and giving a talk tells me that you're confident and you want to listen. You sitting back and giving a talk or giving an interview is not a good idea at all. And having your foot up on the table and giving a talk, you know that you are asking for not to be hired or not to be ranked high for that matter. Check your microphone, access the tape, test the volume, check your earphones before the presentation. Talk. You can make a dummy call to some of your friends and say, "Can you hear me well?" and things like that. Those are basic common sense, which I'll not go into too much detail. Some finer points as we go through is be ready before a major presentation or talk. Just be ready 10 minutes early, right? It gives a chance to relax. That you're sitting there, you have a water, you have coffee, you have checked everything else, computer, internet, and all those things. If you are going for an interview or you are nervous about technology, not be able to share it, have a printout on the side or have another screen where you can open up all those things as well. Let them know if you have a paper saying, "Hey, I'm taking some notes, is it okay?" Or I'll be referring to some of my notes here. But make sure that they don't hear these papers every 5 seconds that you're turning on these pages and all. So be a little bit of cognizant of that fact and slide them on the side so they make less noise as you're going through. I can't emphasize enough. Prepare, rehearse, and think about some general questions they will ask from the presentation as well. You can display knowledge by knowing the audience. If you don't know, you can ask them. Raise your hand. How many of medical students are in the group, or doctors, or nurses, faculty member, or high school students, whatever it is, and you can engage them from the beginning so you know who you're talking to. Or because you don't have time to each of them to introduce themselves, so you can create some false categories and ask them and let them raise their hand, so then you get to know them and then you can justify and modify your talk as you go through. And some of it, all of it, come from some of these articles. I've read it on Forbes and other places as well, so that you can also read some of these things. So in summary, what I've talked so far in last 20-25 minutes is, and what should be your take home points are: slides, less is more. One slide per minute, maybe a couple extra slides for shorter presentation for introduction and then thank you slide. Use all components of research or research technique or methodology: introduction, background, method, result, conclusion. You have enough flexibility to have one topic higher than lower based on what you need to talk about. And then for graduation purposes, list extra slides where you talk about other projects you helped with or other projects you did it. So those things you can list them additionally. Definitely leave a conclusion for people to know. We talked about effective delivery of using being on time, using the vocal variety, using the pauses, or not trying to avoid any filler words. We talked about virtual environment, eye contact, postures, and general awareness of where you are in terms of the lighting and then the space and then somebody not bothering you as well. And I will say these are great opportunities. Relax and enjoy. You worked hard for 6 months, for a year, and for 3 years as you apply for fellowships and residencies or consultant for a new job. Every presentation is a learning curve that you have learned to do this. Next one is going to be easier than what you're doing it. With those thoughts, I'm not worried about giving my email ID or our hashtag analysis or our um, handle on X now, for you guys to reach out and then use it as well. I'll stop it here and see if we have any questions which I can answer. So a couple of questions being answered is asked is like, is there any limit on number of slides? So I kind of gave it. I think you ask the organizers when they're telling you, they don't tell you. They say you have 15 minutes. That means you have limit of 15 minutes, 15 slides. For graduation and so purposes, I think the limits have been given to you guys like 10 slides or so. But if you can manage 12 or 13, go with it in that time period. I think you have 8 minutes to present and 2 minutes of question and answer for those in wondering what we're talking about. This is about GRSP graduation. Is having a flow chart necessary? Can we add a Prisma diagram? Prisma diagram is your flow chart. Yes, you should definitely add your Prisma diagram if you're doing a systematic review, meta-analysis, or any review article for that matter. Is there a limit for we should consider? If you're talking about number of figures and images, no, there's no limit, but you should be limited by the number of slides you'll be able to use it. You could be smart. You can have a couple of figures superimposed on each other if you know how to use animations. But doesn't mean that you use 10 and 10 images on one slide, because it will take time to explain them as well. So be mindful around it as well. Another question I'm answering is, if you want to mention 2 projects, do we have to have 8 to 10 slides on each project? No, you have total 8 to 10 slides. So you can divide them into 5 each, or make as a second project as a small 2-slide presentation in the end of first slide. Make one presentation as main, or divide them equally in 4 slide each, if you can do justification for that matter. Can we keep the same headings, the manuscript for the slides? Yes, that is the purpose. If nothing else, you should be able to keep the same headings: so introduction, method, results, and conclusion. If nothing else is fancier than that. With that, I'll be stopping the recording. Those who are watching, like and subscribe, and then come back and watch again. Thank you.